name is Melissa Meredith, your host for the Daily Wellness Podcast. If your day could use a dose of healthy living inspiration, you're in the right place. Call me a crunchy mom, health nerd, whatever. I'm just a normal mom trying to do what's best for her family, and I happen to love talking about all things health and wellness. Join me as we learn from like-minded people, change the health legacy of our families, and take our wellness to the next level. Welcome to the Daily Wellness Podcast. Quick review shout out to Rachel Made Music. I'm so excited for this podcast. I love how Melissa describes starting a new legacy of wellness for her children, and I'm excited by how she's sharing her own family's journey as a means to help others see that legacy of health and wellness is available for them as well. I'm so excited to tune into this show as it grows and unfolds. Yes, yes, yes. You have caught the vision, Rachel. This legacy can be for every family. The question we answer this week is, what is integrative dentistry? And our guest is Doctor of Dentistry, Blake Roberts. In a world where we are taught to think of oral care as a thing separate from the health of the rest of our body, integrative dentistry looks at the mouth-body connection. There's a focus on prevention, nutrition, and overall well-being. Want to know more about the use of fluoride? What about root canals and fillings? We talk about that too. Your dental health says a lot about your overall health. So here's your dose of daily wellness. Welcome to the podcast, Dr. Roberts. Thanks for joining us.
Thank you for having me. I'm excited to be here.
I have so much to learn from you. So could you please introduce yourself to us and tell us about your practice?
Yeah, so I'm Dr. Blake Roberts. I'm a dentist in Joplin, Missouri. I've just opened up my own practice here a couple months ago. I am a Joplin native most of my life, really since I was a year old. Went to Missouri Southern for my undergraduate, got a degree in biology and minor in business, and then went on to Kansas City for dental school at UMKC, where I did 4 years before coming back home, practicing in Neosho for about a year and a half in private practice, and then I've been working public health at Access for the last year or so while trying to get this practice ready and off the ground, and now here we are. So that's the professional history. Yeah, and then personally, I am happily married for going on 8 years in May now. Have a little 2-year-old son and then another son on the way here in May. So it's going to be just crazy fun times at our house for a while. So.
Yes, it is. Congratulations on that. I love that so much.
Thanks. We're excited.
Yeah. I was talking to someone the other day, letting them know that I was going to have you on the podcast soon. And I said, Dr. Roberts is going to be on, the integrative dentist. And the first question from my friend was, what is an integrative dentist? So I know you just opened up your new practice and it is integrative dentistry. So can you just tell us what that is?
Yes. So basically, and I chose the word integrative over something like holistic because I feel like holistic is a great term, but it does come with a lot of baggage for some people. So integrative to me is basically really what pure dentistry really should be. And that's just, emphasizing prevention of diseases of the mouth, managing that, not just treating not just being, like kind of a molar mechanic tooth doctor, but looking at the mouth as kind of the gateway to the whole body, and treating people more holistically, really, kind of encompassing their whole wellness. Not just their oral wellness. So it's kind of a name I chose because I thought, I figured that's the kind of dentist I wanted to be. And especially, growing in practice over the next several years, I want to continue to kind of grow into that name and that role and kind of earn that. So that's kind of why we went with that approach. And really it's just focusing on kind of the root cause of the disease and how that affects the rest of our body.
Yeah, I love that. So you're talking about an oral mouth connection with the rest of your body. It's interesting to think of, really, because I think in our modern medical system, in our modern dentistry system, we really do not think of those two things together very often. We have We have separate dental products, hygiene products. We have separate, doctors that we go to for our teeth. We have separate insurance even that we have for dental care. And so that's really, I think, eye-opening, that we can start to put those two together. But as soon as I thought about that for the first time, I was like, that absolutely makes sense. Like, it's really the systems around me that have made me separate it. And just automatically kind of, categorize those things in my mind separately, and thought about my dental care separate from my overall health. So I love that. I love what you're doing. I think that's so important. So what do teeth tell us about someone's health? Or what does our health tell us about someone's dental health? Yeah.
So it really is kind of, and this is the cliche, but it's kind of the gateway to the rest of your body, obviously, because your mouth is the start of your digestive tract, really. And, for years, like you said, and this is one of my biggest pet peeves, is how separate dentistry has been from overall, like, general medicine. And that actually goes back to like 1800s and before, of barber surgeons were different than the, physicians that you went to. And for some reason, we decided that'd be a good system to keep. So that's kind of a little side tangent there. But I think going forward and integrating dentistry with medicine is kind of the way to go. And as far as what they can tell us about someone's health, I can tell looking at someone's mouth, if they're showing signs of, they've got acid reflux here. I can see the erosion on teeth from that, or I can tell, they're clincher and grinder. Well, maybe they're, struggling to breathe at night or during the day, and they're, trying to posture forward to literally be able to breathe. And that's why they're clenching and grinding. And really, teeth are, and that's kind of one of my frustrations with medicine, is that they really honestly are not trained at all in looking and diagnosing anything dentally or orally beyond a certain point. So they can't view that as kind of the overall picture of, say, treating a sleep apnea patient or someone with digestive health issues. They just kind of, stay in their own little box and don't really venture outside of it too much. So I'm kind of hoping to kind of be part of a generation of dentists that takes control of that, and kind of help start working with physicians to actually treat and heal people. So that's kind of my passion right now.
I love that. That is one area where I think modern dentistry has kind of gone wrong, if you will. Is that it starts at the training, really, for what dentists do, as you mentioned. Can you think of some other areas? Like, you kind of started in more the modern dentistry, and that was your training, and now you're switching. So what other things were kind of like red flags to you of like, I don't think this is the way I want to go?
So that was kind of a whole journey there too, of really, and for me personally, this kind of questioning the status quo started in 2020 with everything that we were told was, the science and forced to do and forced to believe. And I started kind of questioning things in general, and then kind of started going down the rabbit hole of, well, what if this thing that I was taught is not actually how it is, and kind of all of that. And then my dad, obviously, having had him on here, you guys all know that, he, for the last 10 years, has really been kind of questioning everything. So that was kind of a kickstart to me too, to say, hey, maybe there's more to dentistry than Dr. Drill and Fill and slapping these 1980s amalgams in people's teeth, and not questioning what effects that could have on them as a whole. And sorry, I probably got off on a tangent there, but you can bring me back in if you need to.
No, I want you to go on all the tangents, up on all the soapboxes.
There's a lot of, I've got a lot more soapboxes from the last 3 years, and just kind of the veil has been lifted from my eyes, and now I can't unsee what I've seen. And to me, that's exciting about what the next 20, 30, 100 years hold in medicine, as long as we kind of get out of our own way with our preconceived biases, and what we were taught is the science. So
you're on a beautiful journey of thinking for yourself.
Yes. basically, which I was always taught to do, but it was kind of, forced upon me even more so in the last few years. So that's kind of where I got to this point today.
Yeah. Yeah, I love that. So definitely in integrative dentistry, we have a mouth-body connection where we're thinking
Yes.
of the person as a whole. You already mentioned also that it's, more preventative in nature. So you're
Mm-hmm.
thinking about ways to not just fix current problems, but to prevent things,
Prevent future.
early
Yes.
on. Yeah, I love that. What about, would you say, like, as far as procedures go, is there a difference in how you approach, potential procedures that may need to be done and how you make decisions
There
about that?
there definitely is. So I see things through a little bit different lens than probably your average dentist does. Um, because of some of the training I've had now, in kind of like oral medicine toxicology, with, maybe I decide that root canal in that tooth, is there a place for it? Potentially, yes, but there's no such thing as a perfectly clean root canal. So maybe we look at an alternative option there. Um, you come in with several, cracked amalgam fillings, and we've got a safe way to remove that. Um, that's been approved by the International Academy of Oral Medicine and Toxicology. That's just really, quite frankly, once I learned that method, I was like, yes, this is common sense. Why are we not just doing this anyways? And, maybe we look at putting BPA-free composite fillings in instead of just slapping whatever we're most comfortable with in there. Instead of and just simple things like that. I would say the day-to-day, what we do, clinically does not change too much technique-wise. It's just kind of the evaluation of everything and just kind of looking at everything a little more globally that really has changed how I practice. So, but
Yeah.
as far as the procedures themselves, it really doesn't change a whole lot. It's just more at kind of the treatment planning level and thinking about what the best long-term options are for patients.
So you mentioned there's no such thing as a perfectly clean root canal. Can you explain that?
Mm-hmm. Yeah, and there's an inflammatory thing right off of that there. But I would say, so root canals in general, there's just no perfect way yet. I mean, we may get there eventually where you can completely clean all the bacteria out of a dying tooth. There are better ways that I've actually seen in the last 6 months to a year that have come out with like some of these laser irrigation therapies that they're doing where they get it pretty close to clean, but to me, it's just a matter of time before a root canal fails. If you live forever, it's going to fail at some point. It's just a matter of when. And yeah, there is really technically no such thing as a perfectly sterile root canal.
And what can happen if that doesn't, I mean, if you don't get the bacteria out and that
Right.
air, like what happens?
Well, and when I say, let me clarify for people, I'm using dental jargon, but failure would be you get a recurrent infection coming back again, basically, that would cause you to either need to go in and clean out the root canal and do it again or remove the tooth.
Yeah.
So
and then can that infection?
And that obviously affects your overall health,
right?
Because your immune system is trying to constantly fight it.
Right.
A lot of times we don't actually catch it. Now with some of our new imaging, like 3D imaging technology, you can catch it a little earlier. But a lot of times back in the day, it's, the patient comes back in and they're like, man, I feel like this is uncomfortable now. And they've got a bump on their gums where that infection's trying to drain. And you're like, oh man, here we go. So
I've actually heard that some people have had blood work done and been able to detect some infection going on in their body that was actually related to their mouth.
Mm-hmm. Yep, that is definitely true. And we've known about the connection between like our gum health and cardiovascular health for years now, which is that's a whole nother rabbit hole there. But now I feel like we are starting to see, oh man, these infections in the mouth are really affecting our immune system, and we're constantly fighting this, which then, there's no way to even track the downstream effects of what's actually happening as a result of that. Because every, patient comes in with all of these symptoms, and there's 10 different factors now that you have to take into effect. And people just tend to gloss over the dental aspect in my experience. So,
Yeah. Okay. That's really good to know. You mentioned fillings, which I have a little bit of an interesting story, kind of related to how I have learned about dental health and all of that. Of course, just in my course of learning about health in general, like I would see different things about dental health and see different suggestions and things for how to approach your dental health more naturally and holistically. And so one of those things was just really considering how you treat cavities.
Yes.
Which there are actually a lot of things in the natural health world that can be tried. You can try to heal those cavities naturally. But if you do decide to have a filling, there are lots of different kinds of fillings. Is that correct?
Yes. There are several different kinds. Yes.
Yeah. So I had one child.
Details. Yeah.
Yeah. So I had one child that needed a filling for a cavity. Or at least that's kind of the direction we were going. And so I started researching that and really decided, I didn't want a mercury filling, which I'd love to talk about that a little bit more.
Right.
But I also didn't want a filling with BPA. So I went to the dentist that we were currently using. And that just made sense to me. I was like, I'm already trying to avoid BPA in my life. Like, get it out of my home, get it out of my kitchen.
Right.
I know that it's, can cause cancer and has disrupt your hormones. I was like, I don't want this. And so I was like, it doesn't make sense to have it in your mouth. And I asked the dentist that we were using, and they had no idea if their filling had BPA in it or not. And so I was talking to them about that, and they said if you have information about why BPA is bad, can you send it to me?
Oh my goodness.
And then they said they would get back to me on the ingredients of the filling material. And so I waited, never heard back. And they said, well, we've called the manufacturer. We've looked through the, materials that they've given us, and we don't see anything about the ingredients. So we're still waiting to hear back. So it was quite a process. And eventually they did find out that their filling material had BPA. And I called around to several dentist office in my area, and I couldn't find anyone in my local area that would fill a cavity without BPA.
Yep.
It was flabbergasted.
Yep. And thankfully now there are several available that are, and that's just not something that they even discuss in training at all. Like, it's not even mentioned. In fact, I remember, this is just an anecdote. I can't remember the specific professor, so I won't call anyone out or anything, but he said, yeah, all these people are worried about these amalgam fillings, but I feel like we're going to find out something about these composites too at some point, and that they're even worse. And I was like, what? And then he just kept going. I was like, excuse me? That's like,
we not have any research?
Yeah. Like, we're putting this in people's mouths and just hoping for the best. Like, you wouldn't use a BPA water bottle anymore. Like, they're all BPA free and says it on the packaging, but yet we're putting these things in our mouth that are going to leak all of this. It's mind blowing to me. So, yeah. But that is the world we live in. So,
and are some dentists still doing metal mercury fillings?
Yes, they are. And actually, it's still, much to my amazement, it was part of my training in dental school and still is today a requirement to learn how to place them still. So
why, I know part of your practice is removing them if people would choose to do so. Why is it important to have that out?
There are studies that show systemic mercury content is higher in those that have, I believe, it's 3 or more amalgam fillings in their mouth. The study concluded that 3 or more, it was the most visible in the blood work and everything. But yeah, basically, to me, just from a dental perspective alone, let alone the mercury content, I am not a fan of, obviously, the silver color. You see, I literally daily, I see people who have even 10, 20, 30-year-old amalgam fillings with just cracks all around them that you just quite frankly don't see with the resin composite fillings, and they're just unaesthetic. They don't bond to the tooth. They cause cause cracks like crazy. And then there are studies that show that there is mercury leakage over time. So and no one wants that in their body.
Yeah,
So
sure.
if they're reasonable alternatives, which to dentist credit, I will say 50 to 100 years ago, when there literally wasn't another option, I understand how they went about using that, but there's actually 100-year-old case studies where they even examined removing amalgams in people, and their, neurological symptoms that they had previously walked in with and disappeared over the course of a couple of years. So to me, I just don't think the benefit of putting an amalgam in outweighs the risk at all. So
yeah, I think that's great.
That's my soapbox. So
yes. Yeah, I love that. I personally had a friend that did have their mercury fillings removed and almost immediately noticed a difference in their overall health. Just migraines, especially, not as many migraines, several health issues that really lessened or went away connected to those fillings. Yes. It was fascinating.
And even aside from the mercury itself, I mean, some people are just more prone, and my dad can speak to this more than I can, obviously, to just heavy metal sensitivity. And you have that in your mouth constantly. And we know from even just chewing natural tooth structure that you're kind of microscopically removing tooth structure almost every time you chew over time. So imagine you're removing that silver filling material. I want something going down the throat that I feel comfortable being in my body and passing well and not retaining it, So yeah, there's another side tangent soapbox, but I don't place them, and I when I can encourage someone to remove them, I typically do.
Yeah, I think that makes a lot of sense. If there's a better option out there, safer option,
yes.
you have to weigh the risks of, the risk and safety factors of all your options, and that one just doesn't.
Yes. And,
so another,
and like I said, from a dental perspective too, it's really to me an inferior product anyways. So
another issue that I know is hotly debated is fluoride. Can you kind of give us your take on fluoride and
So I will say, much like, this is a total doctor answer, but neither, or somewhere in the middle. To me, I am not a fan of how we have pushed fluoride today and just pushed it in everything. And to me, putting it in the drinking water and things like that, you can't personalize that care for that specific person. So and to me, the fluoride varnish that you put on a kid's tooth, once or twice a year, is it really? And I believe, if I'm remembering back right, the studies show it boosts it for like 3 to 6 weeks in the tooth. And for people that are really prone to cavities and they've got dry mouth and things like that, I have seen it be successful. But my question now over the last 3 years is always, at what cost are we doing that? Everything has a trade-off, and to me, I think as a field and as a society, we've pushed it as, the science says, this will reduce cavity rates by 25 to 30% in the population if we put it in the drinking water at this parts per million. And to me, again, the question is at what cost? Because it's not a replacement for good brushing and flossing habits and actually removing that bacteria from your mouth and breaking up that bacterial biofilm. So I feel like we're, shooting an elephant gun at a squirrel, basically.
Yeah,
that's a crude Southwest Missouri analogy probably there, but to fix this problem that, we still are seeing high cavity rates like we were 50 years ago. So it hasn't cured disease in that respect. And I remember my dentist growing up saying that, 50 years ago when I was in school, they were saying that by the time you're done practicing, we will cure dental decay. And if anything, I would say the same or worse than it was 50 years ago. So
Yeah.
I
Yeah.
I
Let's
just
talk about
I
that.
just question at what cost.
Yeah, I agree. So the things that we're talking about, like, the things that are always recommended, brushing and
Yes,
flossing, the fluoride treatments. I mean, those are all like superficial care, the things that you do to the outside of your tooth.
yes,
But I feel
yes,
like, and I have seen more and more research coming out that your dental health is really more about the internal health of
yes,
your teeth. So
yes,
what does that mean? Like how can we take care of the internal health of our teeth?
yes,
Do we prevent
yes.
cavities by putting things on top of our teeth, or do we prevent cavities by having strong teeth?
You prevent cavities by having strong teeth, yes, and basically removing the need to basically repair the tooth, because fluoride, really the whole purpose of it is to remineralize the tooth that's been demineralized. And that demineralization sometimes, if the tooth does not perform properly during development, you're more prone to it in general. But you really demineralize it anytime you change the pH of your mouth more to be more acidic, and you're basically just acid etching your teeth all day long with sugar containing foods and drinks, or any obviously like acidic pH drinks, like, and this is the hard one for me to kick, but coffee is another one that has an acidic pH and will basically kind of etch your teeth, and things like pop and sugary drinks, juices, um, basically just kind of fight, what God intended for our teeth to be made up of, which is that strong outer layer of enamel that's literally as hard as diamonds in our mouth, that we just, through our Western diets and all the processed food that we've been pushed over the last,
Mm-hmm.
50 plus years, are not conducive to good dental health. And we wonder why um, our cavity rates are so high still after this many years of trying to fix it. So
Yeah, I agree. Do you have any thoughts on, some things that we can do to improve our health other than those superficial treatments? Like, what are some things that
yes,
you would recommend for dental health?
yeah. So diet in general is huge. More proteins and fats. Um, Vegetables are great too. Vitamin C is really good for gum health, with kind of helping that collagen in our gums to stay healthy and strong. Um, yeah, really just honestly thinking about more like ancestral type diets of what they ate several hundred years ago before processed sugar was invented, and somehow we didn't have all these issues with cavities back then. I wonder why.
Yeah.
That's really a new thing in the last couple hundred years, really. So I think trying to limit the amount of sugar in your diet, eating more natural foods, fruits and vegetables, and protein and fat, and having a diet that consists more of those basic, um, more organic, natural foods is the way to go to prevent this from being an issue in the first place.
Yeah, I've heard a lot about the ancestral foods being beneficial, especially good
Hmm.
quality animal fats.
Yes.
Making sure that we're not eating industrial fats, but getting,
Yes.
really good quality animal fats. Any other like
And
specific nutrients? I mean, like what kinds of
yeah, so organ meats are great. Unfortunately, I'm not a big fan of liver, but liver is one of the ones that they always tout as being really good with vitamin K2, which is really good for our calcium component in the teeth, and then our bone health as well. Leafy greens and properly prepared nuts and seeds without preservatives. That's always one that they push to. Um, yeah, and then really citrus fruits and berries are good for our gum health. You have to be careful with that and limit it a little bit, because there is acidity to that as well. So it's actually dentally better to eat in one sitting a little more than snacking on something all day long where you're constantly keeping that pH down. Another tip is to rinse with water really well after you eat or drink anything even slightly acidic, to kind of neutralize the pH. Um, but yeah, basically just sticking with those, what we think of as, what should be healthy foods, and realizing too that what we've been told about, I would say, fats and cholesterol and the food pyramid and all of this that we've been kind of indoctrinated into our whole lives may not actually be true. So
Yeah.
just trying to kind of think outside the box and look, um, take nutrition more seriously than we have as a society over the last 50 years.
Those are great tips. One quote that I heard from Dr. Stephen Lin, who works with the Weston A. Price Foundation,
Mm-hmm.
he said that dental disease is a modern phenomenon.
Yep.
Would
It's
you
it's
agree with
true.
that?
It's true. Yes, it is. It is a modern phenomenon, and one in which, for whatever reason, the powers that be have decided not to address the root source of. So, yes, it is a very modern phenomenon. I mean, I do believe. I mean, we hear about George Washington's wooden teeth or whatever back in the day. So people still had some kind of dental disease, but it was probably a little bit more periodontal, like gum disease in nature, than actual full-blown cavities and everything. With the gum disease like we have today, we just have it all now. So
Yeah, true. Yeah, I mean, it's so interesting. It really does make you pause and reflect. I mean, if we have all the technology that we have today, and we have, all the knowledge and research that we have today, and dental health is not improving, I mean, that just really
Yes.
reflects what is happening
Yes.
with our overall health
Yes.
in America, especially.
Yes. And there's no good reason for it, which is why honestly I'm excited to be kind of going down this rabbit hole now. And I feel like now that more people are waking up and taking the veil from their eyes, we're gonna learn more and more about how to actually treat and prevent disease in a way that's less toxic and more effective than we have over the last 100 to 150 years in this profession. So
Yeah, perfect. All right, as we wrap up, I have a few questions for you. And one is, if someone wanted to learn more about health, or really dental health specifically, what kind of resources would you recommend for them to start digging into?
Yeah, so one good website that has a lot of good, like, kind of patient packets and information that have really good nuggets in them it's called the International Academy of Oral Medicine and Toxicology, so IAOMT for short. They have several good handouts and resources on there that go a little deeper on some of the topics we covered today. And they actually do a really good job. I've been impressed with. They back pretty much everything they say up with research studies to support it. Yeah, I'd say that's probably the best one. I also, if you're interested in learning more about kind of airway issues, which is something I've become passionate about, there's a couple of good books that are pretty quick reads on that, called Breathe, which is written by James Nestor. And then another one whose author escapes me is Close Your Mouth, that kind of talks about something called the Buteyko breathing method. That's really, really good that we promote in our practice.
I love that. I'm definitely going to check those out.
Yes, they're really good resources.
So as an integrative dentist, what's your favorite healthy snack?
So I've kind of been more on kind of a protein and fat kick lately. So I don't know if you've heard of them, but the Chomps bars are really good. Kind of more of a, bare ingredient, jerky type bar. So for me, when I need a quick boost of protein and energy, I usually eat one of those. So
yeah, we love that. We love that brand. Another one that does a really good job with ingredients on their meat sticks is Paleo Valley.
Good to know.
If you want to branch out, they have a few different stick options and are really good as well. Good quality and taste great.
I'll have to check that out.
And then who would you love to see as a guest on the Daily Wellness Podcast?
So I had a couple ideas for this one. One is actually another integrative biological dentist in Kansas City that is a classmate of mine, Dr. Jim Kleffel. He actually is more of he does general dentistry as well, but he has more of like a TMJ sleep apnea specialty practice that he does with his father-in-law. That would be probably an interesting one. And then my other one was Dr. Jeff Johnson, the chiropractor, and Joplin would be a really good one as well.
Yeah, I think those are great recommendations. Thank you so much.
Yeah, absolutely.
So if people wanted to connect with you, learn more about your practice, how would they do that?
Yeah, so we've got a Facebook page at Roberts Integrative Dentistry, or website if you want to kind of learn more about us at robertsintegrativedentistry.com. And we're planning to kind of add more to the website over time too. And I wouldn't call it maybe blogging yet, but have more content on there and resources for people to learn more about what integrative dentistry is and kind of what we do in our practice. So that's different.
Awesome. Well, I really admire you for what you're doing and the steps that you're taking to kind of really follow your gut instinct and do what you feel is right as a doctor, but also just how you're taking care of people. And just in my experience of knowing you, I can tell that you do really genuinely care for people, and that really comes across in what you do. Thank you for your time.
Yeah. Thank you. I'm happy to be here. Thanks, Melissa.
Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.